start the treatment off by doing some effleurage on the back, and you're looking at spreading the oil on the entirety of the back in the arms to prepare us for the cupping techniques. What we're going to do with the spine, especially generalized back pain, is we're going to focus on the erector muscles and putting cups all the way down beside the spine on both sides of the spine. I'm using the vacuum pump cups here for a good amount of suction. Now, the erector spinae relationships are that it's covered by the thoracolumbar fascia, the serratus posterior inferior, the rhomboids, and the spleniae muscle groups. The erector spinae is formed of three muscles, with its fibers running more or less vertically throughout the lumbar, thoracic, and cervical regions. So the cervical in the top, thoracic in the middle, and lumbar in the lower, as you guys know. The iliocostalis is the most lateral, the longissimus is in the middle, and spinalis is closer to the spine. Now, the clinical relevance of this is that the main pathology associated with generalized back muscle pain is going to be a feeling of pain. These muscles can develop spasm and can be debilitating. So basically, what I'm looking to do with the cups here is I'm assessing the tissue. I'm just seeing how does it feel on both sides. Is one side more restricted than the other? It's definitely an interesting way of assessing the back because when you're decompressing the tissue and lifting it up, it allows it to kind of suck up into the cup. So when you're doing your assessment, I think it's kind of a cool way to see, hey, where is there tension? Where is there a lack of mobility? At what portion of the spine? Is it in the cervical, thoracic, or lumbar region? At the same point, you're decompressing the tissue, and that's going to be good for relaxing all the muscles around the spine, the erector spinae, and all the attachment sites of all the muscles that go into the cervical, thoracic, and lumbar spine. In patients with low back pain, there's usually decreased activity and atrophy of the multifidus muscle, which accounts for spinal stability. The spinal control is compensated for by the increased activity of the erector spinae muscles to stabilize the lumbar spine. So decompressing that area around the low back is going to be great. And the same goes for the thoracic and the cervical region. When we're decompressing the tissue in all those areas, especially if someone has a lot of tension in their back, maybe they sit a lot, maybe they have a forward head posture. So just opening up that tissue, increasing some circulation is going to be good for all the tissue of the back and for generalized back pain. Sometimes the increased activity of the erector spinae increases the compression load on the vertebral column, which stimulates the nociceptors of the spinal structures continuously, which can increase the risk of injury. So, doing the cupping on both sides of the spine, is really good for reducing risk of injury, and it's a good prevention technique. After I've taken off the cups, I'll do some effleurage, just nice and slow, and that's just a good way to spread some of the circulation. So many people hold tension in the upper trapezius muscle. This is where we hold a lot of emotional tension. So I'll allow two cups to be on the area and to recognize that the upper portion of this muscle decelerates head movement, the middle portion decelerates protraction, and the lower portion decelerates shoulder elevation. Myofascial trigger points in the upper traps can lead to tension headaches with sharp pain felt in the temporal bone, the jaw, behind the eye and ear, and along the side of the neck. Occasionally, pain will travel to the back of the head with a burning sensation that can be experienced down the spine, the shoulder, and middle back. Myofascial trigger points here can also potentially cause a loss of balance and dizziness, and can be mistaken for other more serious things like neuralgia, spinal stenosis, shoulder bursitis, and arthritis. So I'll use the cups in that area and just work on the upper, middle, and lower portion of the muscle. And then I'll start doing some flash cupping after I've done that dynamic movement cupping. With flash cupping, I like to take 2 vacuum pump cups and then I'll slowly move them up the body as I'm working. Some people like to use 3 vacuum cups, but I prefer 2. It just works a little bit faster and I think works better for flash cupping. So flash cupping involves quick, repeated application of the cups with minimal retention. It reduces local congestion and stimulates circulation over a broader area. So after we've done the static cupping and we've done a bit of dynamic movement cupping, flash cupping is a really nice way of stimulating circulation and decreasing congestion. I really like this technique. I think it's incredibly relaxing for clients. It's good for superficial techniques like lymphatic drainage. And also, it's just a technique that's kind of nice to perform as a therapist. So you want to make sure you maintain a consistent rhythm and that you cover the entirety of the back when you're doing this. As you guys can see, I'm quite swiftly but consistently moving up the entirety of the back. And I'll even move into the side of the arm, which is going to be good for warming up the tissue before we go in and work on things like the shoulder, frozen shoulder. And we're just maintaining that consistent rhythm. This looks like it would be a lot of work for a therapist, but I actually find it's pretty easy to do this and really relaxing for the therapist and the client. After you're done, just take the cups off and we'll move on to the next part of the body.